It's recording. People are coming in. Give them a little second for everybody to come in. All right. My name is Dwayne Ellis. Good afternoon, everybody. I'm a person in long-term recovery, and what that means for me is that it's been almost 6 years since I felt the need to use any mind-altering drugs to change the way I feel. And today I speak out about recovery because there was a time where I was silent about it. I was shamed. I was embarrassed. And now today I know that I have a voice and I speak out loud so that others can realize that they also have a voice. Whether they be in recovery or active addiction, they still have a voice. Welcome to the December webinar, and it is titled Politics and Policy, the Impact on Addiction and Recovery by Jeff Breedlove. But before we get started, I want to go over a little bit of housekeeping. So first, those who stay for the entirety will earn 1.5 CEUs. When submitting your CEUs, keep up with your month, topic, and panelists. So for example, today's, what you would write down for today is the month is December, the topic is politics and policy, the impact on addiction and recovery, and the panelist would be Jeff Breedlove. We're closing the year out, so just make sure that you're keeping up with information like that as you submit your CEUs. You won't receive a certificate, just a follow-up email thanking you for your participation. You will be muted. If you have a question, raise your hand or use the QA box. Me and Tia Morgan will be keeping up with we'll be monitoring the chat box and the Q&A, and we'll try to get to everybody's questions. And without further ado, I'll let Jeff introduce himself, but this is our Chief in Communications and Policy at GCSA, and Jeff has done a lot of work for the community, and he's definitely respected. So Jeff, with that being said, I'm gonna turn it over to you.
Thanks, Dwayne, and thanks, Tia. So good morning or good afternoon, everybody. I'm Jeff Breedlove. I am a person in long-term recovery. What that means for me is a couple of things, but the one I'll share is that just recently I was so excited to celebrate 5 years of recovery after 30 years of active addiction. And I get to be a part of an organization like the Georgia Council on Substance Abuse and have my son be present for him and my wife. And it's just a wonderful, wonderful thing. So we'll talk about politics and policy and its impact on addiction and recovery. And so keep that in mind as we go through these slides. And what I want to do now is ask you to, okay, hold on one sec. Got to make sure we're doing this right. It's not letting me share. Now let me move the screen. DJ, hold on one second here now.
Okay.
My screen's not moving forward. IT's coming. Hold
on. Okay.
All right. Hopefully that worked. So what's right with me so far has not been IT, but normally what's right with me is that's my son, Jack Breedlove. He is my gift from God, my proof that God is real. And he plays football at Hampden-Sydney College. And every day he's just my blessing. So I'm wondering if you want to put in the chat box, if you feel led to do so, a short version of what's right with you today. You can just use one word or a phrase or something, but if you'd like to share with folks in the chat box what's right with you, you're invited to do so. Also, if you want to put in the chat box what cares you are. I'm CARES 37. I'll put that in there. It's the best cares. That's me, CARES 37. And also maybe I always love to know where you're from, where around Georgia. I'm in Grant Park here in downtown Atlanta. But if you want to also let us know where you're from, I think it's kind of cool to see. There's Douglasville coming in, Atlanta, Decatur. Got a lot of cares coming in. I love this. Tifton, the west side of Atlanta. Mac, I'm on the east side of Atlanta. We got Macon. It's just wonderful to see all these folks sharing around the state. You know, I believe, like Neil believes, that when we share what's right with us and we just take a moment to appreciate who we are, where we're from, the fact that you all are not the best Cares ever, but you know, some of you can fight for second best because Cares 37 rocks. But isn't it great to be a part of a thing like that where we can make jokes about which academy is the best? Because there was a time in my life where that certainly wasn't going on. And there's Athens checking in, and Cleveland, Georgia. Shelley's in Cleveland, and another Athens, Milledgeville, Michael. I love this. This gives me energy. It gives me hope. I just love seeing our recovery family, our Cares family. And thanks for honoring me with a little bit of your time today. Keep putting them in. There's Valdosta. And you know I love it when Valdosta checks in. So there we go. We're going to do the first poll. So here we go. First poll is going to come up before we get going.
And it's up. So we want to know who you are. A peer providing support to people in or seeking recovery. Are you a family member, a person who supervises peers, a person who's primarily involved in administration, or a person providing clinical services, or other? Seems like everybody is A so far. A peer providing peer support. Give you a little bit more time and then we'll end the poll.
And we have a couple of polls throughout the day today. I actually put some thought into these questions. There's a method to it, and I can't, Palins can't vote. So I can't vote, so there you go. So I want to get, oh, look at that. 79% is a peer providing support to people who are seeking recovery. And we jumped down to a couple at 17% there. That's great. And we have a couple at 3 at 4%. So thank you, each and every one of you, for what you do for recovery, our community, and someone that you know or love, including yourself in recovery. I got to give a shout out. This new PowerPoint was designed by said Jack Breedlove right there, who's still on the screen. So Jack, thank you for doing that. Although we're still not able to change the screen. Dwayne and Jack, I'm hitting that button and the screen's not moving.
Can you just hit the right arrow, like for
That's what
next?
I'm hitting the arrow. Hold on. So let's get into it, and hopefully I will get a good flow going for us. So I want to ask you this. When you were in active addiction, were any of you thinking about advocacy for recovery? The answer is probably not. I sure wasn't. And then you enter some type of your multiple pathways that we believe in to recovery. You go through whatever you go through to go from active addiction to recovery, and you're sitting around thinking about everything. And probably the first thing that crossed your mind was not, hey, politics and government, and I can advocate for this, because that's not the way most people think. But I want to tell you this, and I promise you this, it's extremely important to our community, because what we have is a disease. This is a medical issue. And the number one thing that impacts us is funding. And funding comes from 3 or 4 different sources. It could be from private donations from a citizen or a family trust that could give money to a group or an entity. It could come from a business like Joe's barbecue place in your local hometown, or Coca-Cola or Delta, and everything in between. Or it could come from your local government, the state government, the federal government. But underlying all these programs, including this program, CARES, the CARES Academy, is funding. There's an old axiom that you can't save the world if you can't pay the rent. So funding matters to us as a community. It allows us to have peer-led programs to provide services to ourselves and our community. So, I'm not here to tell you that I'm right or wrong, but I am here to tell you that without funding, a lot of this stuff wouldn't happen. So funding matters to us. And it matters that this is a medical issue, that it's based in science. We're not bad people who made bad choices. We're good people with a bad disease. I believe that. I did not always believe that, but that is in fact the reality. So when this country's divided on so many things, DJ and I were talking before we went live, we're even divided over, should you get the shot or not for COVID? I mean, this country's kind of split on that. But one thing we're not split on, and we'll get into this a lot throughout this presentation, is that addiction or substance use disorder is killing more people than anything else. And it doesn't really care if you're a Democrat, Republican. It doesn't care how you love, how you pray, how much money you have, where you live, what you look like, where you were born. The disease doesn't care. Now, how we've dealt with the disease, people have done some and made some bad choices, but it's important to understand the disease itself, it doesn't care. It comes after everybody, and nobody's immune from it. Now, it matters because it impacts people, families, and communities. And it's devastating people, families, and communities. It's devastating us from a human perspective, from a cost to run our healthcare, our education, our criminal justice, our medical cost, our government cost. It's costing and costing and costing because we're not addressing it the right way. And it impacts jobs. I mean, I don't know about you, but at the end of the day, most people want to have a job, and most people want to be able to enjoy a certain lifestyle and provide for themselves and their families, their kids, loved ones. Most people want to work. And we have to fight discrimination and barriers that keep us from re-entering the workforce often. And we're going to get into that. So, hey, now the thing's working. So great. So I'm going to give you some key facts on substance use disorder. And this is one of the longest slides, so don't worry. But I want you to understand this. Addiction's very real. And most everybody on a call like this knows that. But a lot of folks don't. But addiction is real, and it's chronic, progressive, and deadly, and it kills people. But recovery is also real. And if you remember nothing from the rest of this presentation, if you remember that one sentence and felt like you could go tell people that, I'd just be so blessed. Yes, addiction's real, but recovery's equally as real. And that's really what we're trying to educate our fellow citizens in Georgia about, that one sentence. There's 800,000 people in recovery across Georgia, according to the state of Georgia, and some 23 million across America, according to the federal government. So we're not alone. We're also blessed because we're the ones that have survived the disease, killing more people than anything else. And so we're sitting here standing on the shoulders of brothers and sisters that we've lost to our disease, and we've been blessed to survive it. And we need to remember those that we've lost to our disease. Now, I've already said it, more people are dying from this than anything else. You can see some stats there, about 3 to 4 people a day. We rank on any given day around 16th in the number of overdose deaths. And during COVID, Dr. Toomey, who is our Fauci for the state of Georgia, she's like the COVID doctor. She did 2 memos that showed that the number one admissions to emergency departments, the emergency rooms, if you will, in hospitals across Georgia during COVID-19 has been because of overdoses. We know this. We know that the CDC just announced that for the first time in history, in a year's period, it was 6 figures, over 100,000 people died from overdoses from opioids. Just opioids, not alcohol, not heroin, not cocaine, not fentanyl, not anything else, just opioids. 100,000 people last year. So you know how bad it is if that's just one category. And you can see some other interesting things there. Georgia, that was a 36.3% increase for us in 1 year. And we went from 1,500 in 2019, 2020 to 2,086 in 2020 and 2021. And I need to tell you that for me, that's completely unacceptable. And we need our business community, our civics community, our faith and education communities, and our local, state, and federal governments to step up and recognize that addiction or substance use disorder, I'll probably say addiction a lot, but the proper name is substance use disorder, SUD, It's the epidemic within the pandemic. And the numbers are the numbers. Those aren't opinions. This isn't a partisan issue. It's a medical epidemic that the state of Georgia and the federal government and our local governments have to deal with. Now, what can you do about it? At this point, you might be saying, Jeff, I didn't live my life in politics like you. I don't like to talk to people. I don't know how to talk to these elected officials. And I just don't, you go do it. Well, I can't do it by myself, and neither can Neil Campbell. I mean, we go to the Capitol for you, and we talk and testify, and they do listen to us. But the most powerful voice in recovery in your community is your voice. And you're on this call because you've already been recognized as a recovery leader. You wouldn't be a CARES if you didn't want to be a leader. Say you were a leader and other people said, you're absolutely right, you're a leader. So you're a leader. And there's no cavalry coming over the hill to help us. I got news for you. You're the cavalry. Oh, sorry, I didn't mean to do that. You're the ones that are there to lead. Now, you don't have to do it this 8 hours a day. And that's what we're going to talk about. How do you help? How do you contribute while you're doing your other job, living your life, but you want to give back a little bit? So the first thing you need to learn about any kind of advocacy, anything you ever care about, it's not rocket science. It's really not complicated, but it's very serious. And at the core, it's about relationships. That's really what it's about. And you can easily build those relationships because 50% of that is just showing up. Most people don't even show up. We're starting to show up. We say nothing about us without us, and we're starting to put that into practice. And so it's all about building relationships. And then it's all about having the courage to communicate. If you can just, you had to give an elevator speech to go to CARES or graduate from CARES and all that. I did. That's really all you need. If you can give a 1 minute speech on why we should support, Bill 1234 to give $1 million for the CARES Academy so we can have more CARES Academy. And if Jeff and Neil write that for you and Marie and Dwayne and Tia and then give it to you and say, hey, this is what you need to say. It's 1 sentence long. Guess what? You can advocate. So we've got your back. We'll help you with all the details. And we're not asking you to go out there and give war and peace, but we're asking you to kind of just do a little to make it a lot. And guess what? When you show up to your Rotary Club or to your city council or your county commission meeting or to some other gathering, virtually or in person, you're the expert. Because, you say, well, I'm a CARES, I'm associated with the council, or I'm associated with this RCO or this organization or this facility. They're going to look at you and say, oh, okay, what do you have to say about this? And you're going to say, well, this, that, and the other. You're educating and people are listening. And that's the advocacy. And I want to tell you right here and right now, nobody cares how you feel about anything. And that may make some of you mad, but that's the truth. Nobody cares how you feel. You might feel like you can open up a barbecue restaurant in your community. And you might feel that you make the best barbecue and, whatever, coleslaw and potato salad and Brunswick stew that there is. So you go down to the bank and you say, I want to open up a barbecue restaurant in this empty building on Main Street, and I feel like it'll be a success. And so I'd like a loan. You wouldn't do that because the bank would laugh you out of their building because they don't care how you feel. They want a business plan and they want to know how you're going to operate your business in writing with math and numbers and words and before they give you a loan. Well, it's the same with a bill or legislation or a policy. We don't go down there and tell them how we feel. We go down there and tell them what we need and want. And then we tell them the why. Here's why you must do it. More people are dying from overdoses in the state of Georgia than anything else. This is a medical crisis. It's not a moral failing. And those numbers validate the need for you to provide an additional $1 million for a new Georgia recovery billboard project. And then you give them some more details and they go, absolutely, here's $1 million, which they just did. But they didn't care what we felt about that. We had to justify it. So we help you with those details. And that's how you effectively advocate. It's not so much about what you feel or what you know, think ought to be. It's, these are some facts. It's a serious situation. We can back up our premise, and here's what we want you to do about it. And by definition, you share that with people and the word gets out. So that's kind of what you can do about it. And by the way, I should say this too, and Tia and Dwayne will help me, but if at any point you have questions, let me know. And Dwayne, I think it's a good point to go ahead and do that second poll question.
All right, I'll launch it right now.
So take a look at that, everybody.
Jeff was speaking about being active in the community. So let's see who's active on these different social media platforms, which is another outlet as far as advocacy. What do we have? What do we have? Almost 100%. I encourage y'all to participate. Let's see if we could get everybody to answer this poll question. Wow, a lot of people not active on Twitter. And I'll end the poll.
All right, let's take a look. 76 on Facebook, 8 on Twitter. So let me be candid with you. You're a leader in recovery. This is not great. The 76 is a C. So Facebook's free, Twitter's free, Instagram's free. So one thing you can do to help recovery before you go to bed tonight is to create an account. It's all free. You don't even have to come up with original content. You can share things that any reputable recovery entity posts, or prevention or treatment or whatever works for you. The council, we post every single day. There's a reason for that. And you can share, just start sharing stuff. But I have had people who are in CARES say, I started sharing, somebody reached out to me, I was able to get them in touch with the CARES Warm Line, and I may have saved somebody's life. You're not a doctor, you may not be their sponsor, but the council is all about connectivity. We're about being a bridge. And so when you share stuff, you don't know where it's going to go, but it's not going to go anywhere negative. It's going to go somewhere positive. So I strongly ask you to connect with your higher power and see if you feel led to join us on social media. So hold on. All right, so let's define our universe for a minute. Now, elected officials and appointed officials, federal, state, and local level, these are important people. They vote on laws, they set policies that literally impact our lives, ours, and our community. But the most important people in those first two things are their staff. And this is the example. Now, remember, I've been a staffer all my adult life. So you're with an organization, you're with an entity, and you're like, hey, we're going to invite the mayor over to see us. Okay, great. Or our congressman or whoever. And they come over and you got a swag bag. Everybody likes swag. I mean, I do. I love swag. And you give the elected official swag, but you don't give that staffer swag. Well, I got news for you. When they go home that night, the elected official is like hanging out with his family, his wife or her husband or whatever. The staff member is writing a report to the chief of staff. The staff member is going to say, Georgia Council, impressive organization, super duper people, they save lives, and boy, we ought to support them when they ask for more money. But if you don't give him any swag and he's in a bad mood and he went to 5 meetings that day and he writes our report up last and he's like, yeah, it was fine meeting, whatever. That could cost you $1 million. So what I'm saying is everybody matters, not just people with titles, but everybody matters. And good advocacy understands that. And we take care and we show respect and we build relationships with everybody, especially staffers. We build it with the media. The media is worth priceless money to us, and we convince a reporter, a journalist, a blogger to write about either us in particular or one of our issues in general. We can't pay for that kind of awareness and support. So we must build relationships with the media, the business community. It's pretty self-evident, but let me give you an example. Every month we have, every September we have Recovery Month, right? And we are so thankful, and we are blessed and thankful that Commissioner Judy Fitzgerald at DBHCD provides grants for us to put on some 20 local recovery events during Recovery Month. A lot of states don't have that. But we have friends with other months that they have their months. And here in downtown Atlanta, there's Pride Month, the Atlanta Pride Month. And every Pride Month, they put banners, literal banners on the street poles all around Midtown with the sponsors of Pride Month. And it's the largest employers in the state of Georgia. It's Delta, Coke, UPS, Scientific Atlanta, Home Depot. It's all of them. And their logos, they want their logo associated with Pride Month. And to get your logo up on that banner, you're talking about $250,000, $250,000. And they raise millions of dollars. Now, people are dying from AIDS. I get it. And they support AIDS through the Pride Month and all of that. I get it, that there's a medical issue underlying it. But ours is the same thing. And we're actually in a hotter situation. And why do they get that money and we don't? It's because the Human Rights Campaign Fund in Atlanta has done a good job convincing Coke and Delta and Home Depot of the following thing. We have an organized community that if you associate with us, you're going to do the one thing. But why do you think Coca-Cola gives away money? Because they care about AIDS or addiction or multiple sclerosis or breast cancer? I mean, they care about it, but that's not why they give away lots and lots of hundreds of thousands of millions of dollars. They do it for one reason and one reason only: to sell more Coca-Colas. That's why they're in business. And if they can decide that it's a smart business investment to give away charity dollars to support causes, they have an underlying goal to find communities that have enough people active that will buy more Cokes if we associate with it. And that's where we have to do a better job. And so we're going to work with our business community, and the same with community organizations. I just finally got to give my first speech to a Rotary Club. They have speakers every week or month or however it works for Kiwanis and Rotary and Civitan and all of them. We should be building relationships locally, saying, when's the last time you had a speaker come in and talk about recovery or addiction? Well, we haven't. You have never asked. Okay, we'll start asking. So we want to get in front of community organizations because they have a platform regularly to causes, and our cause needs to be on that platform in our communities. Some of the worst stigma in the world are the last two. We have pastors and educators who say there's no addiction or drugs in my place of worship or our school. Now, what a absurd statement that is. But then we have others that support us, but we have work to do in the faith and education community. So these are the stakeholders. This is who is impacting our lives or who can make our lives better if we had better relationships with them, okay? How does this really work? And you'll hear me say it. It starts with relationships. It also starts with another premise. Believe me that the stigma is real. If you don't believe that there's a stigma around our disease, and that translates to another word, controversy, it's controversial, then we're not on the same page. But so for the rest of this presentation, I'm building it on the fact that there is a stigma around our disease, and it's incredibly real. And I would suggest to you, for me, it was the most dangerous part of my active addiction. Now, leaders respond to two things, and you need to understand this. Elected officials in particular, money and votes. Money and votes. Now, we don't have any money. Now, if Delta wants them to change a law at the Capitol, they'll write a whole bunch of checks to a whole bunch of lawmakers for a lot of money. And that's legal. And it works a lot. We have votes. The good news, bad news is more people are impacted by our disease than anything else. The good news is there's some 800,000 people that have survived in our state. Think about that. 800,000 people. Well, a lot of them have family, friends, coworkers. So we have this wonderful pool of human beings to say, hey, care about advocacy for our disease. And if we get more and more voices across our state speaking up and speaking out, just like breast cancer has done, who doesn't know the pink ribbon and what it means? And who doesn't know that every October the nation's largest two retailers, Walmart and Target, they basically give shirts away at their store, $5, just to get you to buy a pink shirt. Why? Because they want to show that they support breast cancer awareness. Major League Baseball, the national pastime, every single summer in June or July, I always forget, where they put blue all over their umpires and players on bats and uniforms and wristbands for pancreatic cancer. Well, those communities have learned that that's a good way to communicate. So we have people too, and we can use our community to our advantage. And that's really what we're doing. We're building what Neil Campbell and I call a constituency of consequence. In other words, to say it, we vote. And the more we vote or show up, even if we can't vote technically, if we show up and we speak up, then they react to us. So showing up, like I said, is a big deal. Now my screen's blocking that other one over there. So hold on a second. Yeah, speaking up and showing up, that's a big deal. Now, why do we work so hard on meetings like this? It's because leaders do like a community that has unity in it. When a community is divided amongst itself, especially when it has a stigma, people are like, well, until you guys figure it out and get it together, don't ask me to go vote for or give you a bunch of money or vote for something because, you guys don't even get along. So we work very, very hard to be transparent, to bring unity to our community, because when Neil and I do go down to the Capitol and we meet with the chairman of a committee and we can say, we've talked to all these RCOs or all these other entities in recovery, and everybody agrees on this, and our mental health friends agree on this, and we're all united. They go, oh, well, then I'll move your bill. They literally do that. And if you can't convince them of that, they're like, well, come back to me when you're a little more unified. I also want to tell you this. Leaders want us to advocate, and she's given me permission to say this. Dr. Judy Fitzgerald at DBHTD, she has said in public numerous times to us at ARAD and other places, I need y'all to advocate. And here's why. When we advocate out loud, professionally, Commissioner Fitzgerald can take that information to the governor in the staff meeting and say, well, listen, the recovery community has had 5 town halls and they had 100 people on each of them. And they sent me 600 emails, and I'm telling you, people are going to vote on this. It gives her ammunition. And that's just a specific example. But so when we advocate, we give our allies in business, we give our allies in government the ammunition they need to advocate for us. So that's very important. And I want to tell you that the last way this works, in terms of what we're talking about today, is it really is a bipartisan issue. And I don't know how you vote, don't really care how you vote, don't care what you call yourself politically. What I do know is I have seen so many issues divide this country and the state and our communities. And maybe that's good, maybe it's bad. But what I do know is this: ours is truly bipartisan, and we have that moral high ground when we go into advocate. And I want you to have that confidence that Democrats and Republicans alike want to be for us if we earn their support. So I want to talk for a minute about local stuff. So you see me glance down, I'm trying to keep on track. So we got 48 minutes left, y'all. I'll try not to go over. I'm in recovery from 2 things: crack cocaine and politics. And I'm doing pretty good on the crack cocaine part, but the politics part, I can talk a mile a minute. So I'm working on that. That's supposed to make you laugh. That's exactly right, Amanda. Exactly right. So the stigma, it is alive and well in local communities. If you don't believe me, you need to start. You'll hear phrases like those people and NIMBY. If we were in person, I'd ask, does anybody know what NIMBY means? If you know what NIMBY means, in the next 10 seconds, put it in the chat box. Not in my backyard. That's exactly right. Not in my backyard. So, you know, you literally hear this. Well, I'm all for there being a recovery facility. That's great. You know, there's an abandoned warehouse about 12 miles out of town that nobody ever really goes to, and there's a lot of empty space. Maybe you could put those people out there away from, you know, our pristine parts of our community. NIMBY, not in my backyard. And the legal thing they use, and this is kind of getting close to, you know, an advanced level thing, but it's zoning. It's zoning. They will use zoning laws to discriminate. That's what it is. It's discrimination. Make no mistake about it. And they will use zoning laws to keep recovery facilities, mental health facilities away from places that they don't want them. Now, at the bottom there, I've got 3 examples. In my short time at the council, we're 1 for 2 locally, and it's just reality. So Valor Station is a recovery facility in Augusta. It would only serve or only serves first responders. Look, you know, I'm not trying to get all political, but I think paramedics, firefighters, and police are pretty cool. They kind of rush in to help and save me, and I kind of like them. And I think they're heroes. And I think they're humans, and they have actually PTSD, you know, trauma stuff. They see stuff that we just don't see, and they need a special kind of treatment. And that's what Valor Station wants to provide. And they were seeking some approvals from the Richmond Augusta government, and we lost the vote by a vote. And so they can do some stuff, but not what they want to do. And that was discrimination. In Banks County, which is a small county in Northeast Georgia, one of our good friends, Susan Sorrows, she wanted to build a 6 beds. That's, I mean, even I can count to 6 for women, you know, in this small town of Homer. And we testified for her, and people were in person there, and they said words that I'll tell you in a minute. And we lost that vote by a couple of votes, like 2 votes. But just the other day in Alpharetta, North Fulton County, I testified, and people testified against us, and we won that vote 4-2. And there's like a 68-bed facility that's going to open in Alpharetta, so that's 68 more beds, helping brothers and sisters in recovery in Metro Atlanta that people didn't want to happen. Now, what you need to understand is these meetings are public meetings. They're being videotaped. There's the media there. There's children there. There's people. And people have stood up in all 3 of these places and said, those people will bring their drug dealers in. They will rape us. They will steal from us. They will commit crimes. And you just simply cannot put those people in our community. And I'm sitting there going, well, A, that's me that you're talking about. But I'm listening to hate. I mean pure hate and discrimination, bigotry. And I just want you to understand, those are just 3 examples recently. But I also want you to know there's good news. We had votes and all those in our favor. We won 1 of those 3. And those are just 3 for zoning things, okay? We are building allies every day. And that's an example, though, locally of why does this matter? It matters because people are trying to keep us out of our own communities. Okay, so let's see if I can shut. Okay, so we're going to now do a few minutes about federal, state, and local. Here's our allies. Here's our friends. Here's the good news. In Congress, we have a congressional bipartisan addiction and mental health task force. It's amazing. These are the four leaders right here, the four co-chairs. And you can see on your screen, David Trone, he's got the kind of greenish yellow tie on. He's a Democrat from Maryland. I've had the privilege to meet him. Neil has. This man is the real deal. He is fighting for us every day in Congress. And, he's just amazing. And then there's Ann in the, I think Ann has on the pink shirt, another Democrat from New Hampshire. Then there's Jamie, and Brian is the guy in the other tie. But you see two Democrats, two Republicans. You see East Coast, West Coast, North and South. You see it's cool. And they are working for us every day in Congress. There's over 100 members of this caucus task force. There's only 2 people from Georgia. So as we enter 2022, one change you'll see the council pivot to is you will see us engage more heavily with our Georgia congressional delegation. And there's serious money in Congress right now. There's serious legislation that, frankly, the leadership, the speaker and the 2 Senate leaders, because the Senate's divided, they're not letting all of our bills move. And we have some good bills. And we have to get our delegation engaged, which is what we can do in Georgia. And you will see a very aggressive outreach in 2022, the likes of which we haven't really done yet. So before we go to any further, Dwayne, let's bring up the next poll question about ARAD 2022.
All right, and it's launched.
So you'll see a slide later, but ARAD's coming up in January. It's going to be the 13th annual, I believe, and it's going to be virtual. It's Tuesday, the 25th at 9 o'clock in the morning. You can log in from anywhere you are. We'll talk about it more later, but Neil and I were curious. Anybody planning to actually join us that day?
We got 22 out of 35 so far. Let's try to get to 35 out of 35. 25, 26. We're almost there. We encourage y'all to participate in this. 27.
I'll cheat. The answer we want is yes.
And I'll end the poll and share the results.
Well, that's cool. If the 3 of you want to call me, we can talk offline. But thank you to the 26. Y'all, listen, it's a big deal. We'll talk about ARAD more later. But I did want to go ahead and get that poll question up. And I wanted to highlight, our allies. So there's Washington. Here's the state of Georgia. The Georgia General Assembly Working Group on Addiction and Recovery. It's going to be moving into its 3rd session. This is a big deal, y'all. I mean, there's never been anything like this in the Georgia State Capitol. There's only 4 of these across the country out of 50 states. And we have 4 co-chairs now. That's Senator Randy Robertson in the red tie. That's Representative Matthew Gamble in the blue tie. They're the 2 Republicans. That's Senator Dr. Michelle Au in the glasses and red shirt, and that's Representative Angelica Calche in the blue. These 4 people love you, in case you don't know. And they work hard for you. And they are tremendous advocates. And look, I encourage you to follow them on social media. I encourage you anytime you see them or come in contact with them to say thank you. We have over 50 members, which is extraordinarily good. There's 180 in the House and 56 in the Senate. And they help us with our legislation and our budget. We are meeting, the 4 of them and Neil and myself, on January 4th to finalize our legislative agenda for 2022, which we'll talk about in a minute. And we're going to have an offensive agenda, and it's a big deal. Now, today, I want y'all to look at this slide. About an hour or so after we end this call, I will be launching a press release and post on social media the Georgia Communities Working Group on Addiction and Recovery. So you saw a federal group for us in Congress. You saw the state group. Well, we've started a local government group. These are your sheriffs and your mayors and your county commissioners and your police chiefs and your school board members and all people like that. And we got a great list of inaugural co-chairs from Ware County on South Georgia up to White County and all across the state. And this is so important. And I want to look at my time here. Y'all know that time is fleeting to me. I want to tell y'all this. We talked about that zoning. We said that a lot of this stuff at the local level matters. Well, here's another way it matters. There's a bill in the General Assembly to raise the age. Now, the raise the age bill, in its shortest way I can explain it, right now, if you're 16 years old and you commit a crime, violent or non-violent, it doesn't matter. You're 16 years old, you go to the adult system and you become another stat. You're going to go to prison if that's the case. And, you know, you're a kid at high school and you had some marijuana. We're not for legalization. I'm not, you know, but we're talking about some serious stuff here. So you're a kid who's 16, who's done something that they made a mistake around our disease, and they're going to throw you in the adult criminal justice system and your life's potentially ruined. We don't agree with that. So this bill passed the state house earlier in, this year, in this past January, and it went over to the state Senate, and it got assigned to the Judiciary Committee, and the chairman was for it. And everybody thought it would pass out of the Senate and all that. But two lobbyists got up for the sheriffs and the police. The police chiefs have a lobbyist, the sheriffs have a lobbyist. And they got up there and one of them said, well, you shouldn't pass this bill because if a 16-year-old takes a shotgun to school and blows a student's head off, they shouldn't be exempt from, well, that wasn't even in the bill. I mean, that's a violent crime. This had nothing to do with violent crimes. The bill that scared two members, they decided not to vote for it, and it didn't make it out of committee last year in the Senate. Now, it's still alive, and we're going to come back and deal with that stupid, biased, bigoted testimony. But here's what we learned from that. We know we have sheriffs that support us. We know we have police chiefs that support us. What we have to do is educate them so that they go to their associations and say, wait a minute, I'm a sheriff that's for that bill because I'm for recovery. And I promise you that this is a major mission in 2022 is to educate sheriffs and police chiefs and mayors and council members and county commissioners that they need to be for recovery. And we have a long, complicated plan for that, but I wanted you to know we're doing our due diligence on that. So that's a big deal. And you'll see a lot more about this in the coming days and weeks. Now, I want to take a break from throwing too much facts and figures at you. I may go a little faster, but I want to throw some events at you. Feel free to screenshot these. If you don't screenshot these, you'll see these on our social media. But there's a big rally coming up on January 22nd. And I want you to understand, it's in person. It will not be virtual. In person. It's in Perry, Georgia, which is Houston County, down where IHOPE is. And it's at the Georgia National Fairgrounds. It's going to start at 1 o'clock. This is driven by RCOs. Shout out to Mike at New Life. And he had this idea. He reached out to the other RCOs that you see at the bottom of the screen there. There's been one or two more that have come on. This is an older slide, but it's only growing. And we're going to have about 1,000 people, maybe a little more. And I encourage you to come. There'll be some barbecue and good food and fellowship and great speakers and entertainment. And it's time to put your money where your mouth is. You got plenty of Saturdays to plan and make that a day with you and your loved ones in Central Georgia. And it's free, of course. But come down to be a part of this rally. There's you're the first people to see this. There's 37 of you on here. You're the first people to see the new logo for ARAD. So we'll be making that public soon. I just told you it's January 25th. It's virtual this year. We just didn't feel like the depot could handle. The last time we did it in person, there were 1,300 people crammed into the depot, shoulder to shoulder to shoulder. And we just don't feel like that's the right thing to do. So we'll do it virtually again this year. We hope it's the last year. But we're going to have the governor and all kinds of people. And here's why it's important that you log on from as many devices as you can get people to log on for. Because our co-chairs at the working group care about that number. Like right now we got 37 people. Well, we need them to see the number was over 1,000 at ARAD, because the bigger the number, the more money we're going to get from the General Assembly. And that's about as straightforward as I can be. So why is it important that you log on virtually? So the number is big. Now you'll learn stuff. That's important and all that. But we need a big number, January 25th. Please be a part of it. Cool logo. William Carnes on our team designed that logo with Sierra and Tiana on our team. Shout out to them. I kind of like it.
Hey, Jeff, we got two questions. One is
Okay.
Becky Owens asked, will they get a copy of the slides?
Sure. Yeah. If you, the very last slide has my, and some of you know it, has my email address and my phone number. If you text me or email me and say I'd like a copy of the slides, then I will certainly happily give them to you. It's a privilege.
Thank you. Thank you. And then Amanda asks, she would love some information on how she can help with that in her county.
Help with what in her county, Amanda?
Well, when she responds, I'll just direct message to you.
So Francis, I see Francis's question. Let me go ahead and answer Francis's question. And please don't get mad. The decision currently stands that they're going to have some t-shirts for the rural rally. And we're going to have a patch, first time ever patch for ARAD. It's just the logistics of the t-shirts for the virtual event were difficult last year. Extremely complicated because some of the legal paperwork that has to be done. So we're doing a patch. We had hours of discussions about it, but come to the rally and get a cool shirt.
Amanda, she got more specific with her
question.
question.
Got it, right. I see it. So thanks. So yeah, Amanda, absolutely. So that's a great question. Let's spend a moment on it specifically. So I can get all of you, any of you, and look, you don't have to go through us. Let me just preface that. We're just here to be of service to you, but we are always at your service. So I can help you with, talking points on what to say to the sheriff in your area or her staff people. And we can give you talking points about that bill and we can give you talking points about what they need to do, which is, so I can literally give you simple, straightforward bullet points specifically on the raise the age thing, and you can provide it to your local sheriff and his senior people. Later on, I'll talk about how you help generically in advocacy. So really quickly, I want to talk about the Georgia Recovers Billboard project. I mentioned it earlier. Another $1,200,000 from Governor Kemp. We got to give him a shout out. We always say thank you. His administration's made this money possible. We are in production literally today, this week, for the final week of filming. This year, it's going to have more, it'll have tons of billboards all over Georgia, but it's going to have more of an emphasis on some really, really cool, well done, professionally done videos and other visuals. And we plan to have the ambassadors in person at the 22nd at the rural rally. They will be virtually with us on the 25th. And just so you know, and again, all this stuff we'll be sharing as we get closer. We're gonna have a press conference at the state capitol on the 24th, which is a Monday of January, where the ambassadors will be introduced again, where our legislative agenda is introduced. So even though we're doing ARAD virtually, we're going to have a press conference the day before to sort of talk about it. So the ambassadors are really going to be made public in January. I mean, it's, a big formal push to introduce them in January. So Georgia Recovers. Now, this is a moment, and let me double check my time. So I got about 30 minutes. So, okay. This one I want to spend a moment on. Now, we did a poll on purpose. Some of you are on Facebook, some on Instagram, not so much on Twitter. And we didn't even talk about LinkedIn because I didn't want to push it too far. But listen, hashtags matter on social media. And we've been using this hashtag for almost 3 years. And it's gotten some good traction. So that's a hashtag. If you could take a picture of it, write it down, whatever works for you. But when you do a post on any social media platform about recovery or addiction or whatever, if you would consider tagging it with that hashtag, it would be helpful to our community. And I'll tell you why. reporters, they don't necessarily follow organizations, but they follow hashtags. Businesses don't necessarily follow organizations, but they follow hashtags. So we are populating content in that hashtag part of the platform. And when a reporter goes, so when I'm telling a reporter people care about recovery and the reporter sees that we use this hashtag and they go, oh my gosh, you're right. There's people all over the state talking about recovery. Okay, I'll write a story. So this hashtag, it's important to our advocacy and encourage you to use it. I also want you to know about a new Facebook page. It's a group. It's a Facebook group. That's what the image looks like. That's what it's called, the Georgia Recovery Community events. And we post events that we learn about. So if you're looking for events going on around the state, there's over 850 people on this page. We encourage you to join if you're not. And you just see, it's not about policy as a rule. It's not about the council as a rule. It's just about events. It may be our events. It may be an event from an RCO or an event from a trusted entity that we know is legit. But it's just a way to know about events. And if you got something you want to send us, you can send it to me. I saw that DJ put my email in there, but that's just a place to get events and to share events. And so I want you to know it's kind of new and it's out there. I also want you to know, if you don't get our email, it's at the bottom of our website, and we occasionally post a link on social media, but we've got a new newsletter that comes out once a month called The Impact, and it covers an array of recovery information, from information about the CARES Warm Line to the CARES Academies, to the hospital programs, to the RCOs, to advocacy, to just completely other things that Neil and the Georgia Council team believe to be of value to you to have this information. And if you're not getting our emails, this new edition is worth it alone. And of course it's free, and we don't share lists because that's who we are. But just wanted you to know we got a new newsletter. That's what it's called, and comes out once a month, and pretty proud of it. Sierra and Tiana and William put it together, and I just kind of take credit for it sometimes, but they do the work, and it's a vision of Neil's, and it's good stuff. So I wanted you to know it's out there. I also want to take a minute before we get back into some straight up advocacy. It's kind of letting you, catch your breath a minute. But look, I want to remind you about the CARES Warm Line. There's the number if you don't know it, if you've forgotten about it. We post about it pretty regularly. Look, the CARES Warm Line saves lives, but it's more than that. It's a resource facility too. So somebody says, look, where do I go to get my loved one help? They call the CARES Warm Line. I just need to maintain recovery. I can't afford to talk to you. Call the CARES Warm Line. If it's anything about recovery, the answer can be call the CARES Warm Line. I'll tell you this, every month since COVID has started, the calls and text, you can text as well, they've gone up every single month. So much so that Governor Kemp and Commissioner Fitzgerald have allowed us the grace to hire 2 more people just to keep up with demand, because the mental health of our team is important too. So I want to acknowledge that they've given us 2 new staff members because of the numbers. Again, we made a case, and it was all about numbers. And we made that case, and we got the funding, and we have 2 new staff members for the CARES Warm Line. And use that number, share that number. I'm here to tell you, you might save somebody's life if you do. Also want to remind you, we still do these virtual all recovery meetings. They are going gangbusters. I mean, the numbers are growing, especially in the evening. The morning one's doing fine too. But maybe you've forgotten about it. Maybe you didn't know about it. But you can share this with somebody who's not ready to go back in person or doesn't have a meeting near them, and remind them that we're well past 1,000 meetings, and it's a pretty credible entity now. And Candace Savannah, we were able to hire to facilitate these for us. And she does a wonderful job. I want to thank Candace publicly, and want to encourage you to continue to invite people to come to this meeting if it's right for them, because the opposite of addiction is connection. And if they don't have access to an in-person meeting and they're wondering where to go, that's safe and all inclusive for anybody, there you go right there. So if you want to take a screenshot, I'm going to move it away in just a second. All right, before we do that, I'm checking the chat box. Anything, let's see up here.
No question
Okay.
so far. I'm looking at it
All
too.
right. All right. So listen, do you see it right there? We're the fourth state in the nation that had the General Assembly pass a recovery license plate. You've all seen your Georgia Bulldog, your Georgia Tech, your Valdosta Blazers, whatever. Save the wildlife, save the honeybees, whatever, breast cancer, they're all out there. Well, now we got our own. And we got to sell 1,000, pre-sell 1,000. You don't even have to pay for it. You got to give a $25 deposit before the end of February. And we're not there yet. I'm not even here to sugarcoat it. We're not there. We need to get there. And so I want to remind you, it's out there. It's the one shameless plug that the council does. This license plate breaks stigmas. You may not be familiar with the fact that there is bad traffic and congestion throughout Georgia. And people see these license plates. We encourage you, if you're in a position to get one for yourself. Several of our RCOs are buying them for, and several recovery facilities, treatment centers are buying them for their business automobiles. And guess what? They work on motorcycles. We'll be promoting that heavily. We've already started doing that. But yes, you can get one for your motorcycle. So maybe you're part of a riding club, a recovery riding club or something, there you go. So please keep that in your thoughts and prayers if it's something right for you.
And the license plate, the link to purchase it or to fill out the drop form is in the chat box, everybody, if you want to click on that.
Thank you for that. Thank you for that. Now we're going to use, we've got about, I did about an hour and 15 minutes so we could have some time at the end, but about 20 minutes, 21 minutes and 35 seconds, according to this. I'm going to go through some issues for you. Stop at any time. DJ will interrupt me at any time he sees a question. If I go too much, too little, you don't understand what the heck I'm talking about, because I'm trying to give you just enough to cover a couple of, but these issues here, why am I sharing them with you? Because we anticipate, or we either know for a fact, these will be issues in 2022 that we want to see passed. These are all offensive ones, pro recovery, if you will, issues that we want to see passed to help our community, help ourselves. And so the first one, look, it's hard for me to grasp it. It's called parity. I don't expect you to be a parity expert. It's a complicated insurance situation. But here's what it means to us. It is currently federal law. It passed in 2008, bipartisanly. President Bush signed it into law. It's been in effect since 2009. And here's what it basically means. You can look at that screen, but I'm going to tell you what it really means. If any one of you right now left this meeting and went out to some place and fell down and broke your arm and went to the hospital, your insurance company is going to tell the hospital to fix your broken arm. You may have paperwork problems later. You may argue with your insurance company later, but you're going to get your arm fixed because they get that. But if you went to the hospital today in the state of Georgia for a mental health issue or a substance use disorder issue, the insurance companies are not in following federal law and what they have to provide coverage for on your insurance policies. So for too many Georgians, the hospital turns them away unless they can pay for it themselves or have some charity, but they're turning them away under the guise of insurance. That's A, completely unconstitutional, and B, total discrimination and bigotry, and it's just terrible. It just hasn't been enforced in Georgia. And I'm not here to worry about who hasn't enforced it or blame them or call their names out because they're not even in office anymore. But there's two things we're going to do. We know for a fact that it's enforced in 26 states in this country, and in states where it is enforced, that little Geico friend of ours that we see on TV and the Good Hands people and the little duck that lives in Columbus, Georgia, all those big boy insurance companies, they follow the law where it's enforced, but they don't want to follow it in the states where it's not enforced because they're saving money. You're suffering, your family's suffering, they're getting rich by not enforcing the law, and that's got to change. So we're doing two things. So, that's kind of what's really going on. The first thing we're going to do is we work with Commissioner of Insurance, John King. He's the current commissioner. He didn't get elected. He was appointed because the guy that didn't get elected got indicted. That has nothing to do with John King. But Commissioner King, he's new to the office. We've met with him personally. We've met with his senior staff several times. He's committed if the General Assembly funds the position, which is about $150,000, we really want two people at 300,000. That's a drop in the bucket to the state budget. It's a rounding error, but they would have people in the Office of Insurance that could make sure the law gets enforced in our state. It's just important. It's part of the federal law. And so we're looking for these parity coordinator positions. One is a minimum, two is would be pretty cool. And we're working with the insurance commissioner and the appropriations committee in the governor's office to get the funding for that. We have reason to believe we will be successful. The other thing is, and I don't want to digress too much, but there's this big mental health bill that's coming out from this commission. I've seen it. We've been working with the commission on the bill. The Mental Health Coalition's been working with it. And the first item of the bill is parity. And we're going to have a state law, we believe introduced. It's on track to be introduced, which will further cause the insurance companies to have to follow the federal parity law, because then they would be in violation of state law, which would then give the state the ability to not let them practice insurance in the state of Georgia, which would really hit them in their own pocketbook. So we've got this language. We support the current language. We hope the language stands. We believe it will. So we're having to do a two-track thing: pass a state law to get insurance to follow a federal law. What an insult that is. And also get the state to fund the positions they need to within the insurance department to track the data. So look, we think we'll succeed, but that is by far and away, I want you to understand this for those of you that care about it, that is our number one policy issue for 2022. And I'll give you an example of why. So Governor Kemp he's made it perfectly clear, going to expand Medicaid. And we are not here to talk about Medicaid. But the reality is that's not going to happen. But if we get these two things done overnight, tens of thousands of Georgia families will have more access to mental health and substance use disorder care, because the state will force the insurance companies to follow the law. And people who can't get treatment because they don't have the insurance, even though they pay for the insurance, will now be able to access treatment in our own state. And we will be of service to so many people. So we're going to expand coverage for families and people who are our peers with these two actions. That's why it's our number one issue. And again, if anytime you can stop me and ask me any questions. DJ will tell me to stop.
We don't have any questions concerning what you're talking about right this moment, but Kyle Conley, he asked a minute ago, will the Georgia Recovery license cost more at renewal? Is what he asked.
There is an added cost to every specialty plate, but it doesn't necessarily cost more at renewal. It costs less because you pay the one-time fee up front, and then the second time you renew it, you don't pay that fee again. So when you click on the link and you follow all the prompts, you see all the fees. Those fees are not any different than any other specialty plate in the state. We have to follow state law, but they actually get cheaper on your renewal, not more expensive.
All right, thank you.
So we got about 15 minutes here. I'm going to go through some other issues much briefer. So co-responders, what does that mean? Again, I'm going to talk beyond the bullet point. Maybe at a situation, instead of it being just an armed officer, there's for lack of a better phrase, a caseworker, a social worker, whatever you want to call them, someone trained to help as opposed to arrest. And we do have some traction in Georgia on that. We want to expand the funding and expand the number of jurisdictions or communities where they have that happening, so that we get help, not handcuffs. Okay, so we're going to be working on convincing law enforcement agencies to adopt more co-responder models, so that not everything involves going to jail. Cultural and linguistic competency, and linguistic is a hard word for me to say. So you can see what's there. I mean, look, our community is just growing, our international community, every day. And everybody deserves access to treatment. Everybody deserves the joy of recovery. So we are committed to working with our partners across the state in mental health and substance use disorder, and our stakeholders to work with DBHDD to make sure we have a cultural and linguistic action plan so that language is not a barrier, or culture. I mean, it's not always just the language, even it's the values, the culture. Some people speak English, but they believe different things, and we have to convince them that it's literally you have to convince them that it's not an abject moral failing where the person should be literally banished from the family and the community, as may be the case where this family may have come from back in a different nation. But it's a lot of hard work, and we're going to continue to be leaders in 2022 on expanding support in communities that think different than we do and speak different than we do, or both. So another issue is community support teams. So particularly in rural Georgia, it's just different. I mean, I've been all over the state more than anybody, and they just don't have the same access to facilities and treatment as we do in the Metro Atlanta suburban area. So we need to have teams in place in rural Georgia so this isn't about jail. This is about like serious medical stuff that is just there. So what about having, some of the same services we have in Metro Atlanta for treatment around the state, so they can get outpatient instead of inpatient, so they don't have to be hospitalized. Or told they can't be hospitalized because there's no bed space because of COVID. So these community support teams, they exist, but they don't exist in any way to keep up. Remember, I told you this was the epidemic within the pandemic, and I'm going to end on that point too, by the way. But so we're trying to get more support for people who need it. You can see the theme here. Telehealth, same idea. Not everybody has access to broadband and the internet like we clearly do. We're sitting on this call doing a pretty cool advanced thing. It's just not there. And we have to have the ability for people to get the health care that they deserve, and broadband can't be an impediment. And the state does a little bit, and I think they've done great. But the council's position is any peer anywhere in the state who's paying taxes to the state needs to have the technology they need to be safe and get medical care. And so we are unabashedly pushing and pushing and pushing that every community, every street, every house, every neighborhood needs broadband. And a quick story, I mean, during COVID, there were pictures. I mean, this is a true story. There were school districts in our state that for kids, they couldn't go to school. They were getting homework sent to them, and they were having to meet in their cars with their parents. Remember, parents are trying to work and keep paying bills and all that stuff outside, like the library, because there was one hotspot in town. And so the theory was, well, everybody can go to the library and get on the hotspot. The kids can do their homework. But then they got to the library, they were overwhelming the system. And I mean, these are our friends and neighbors. So we're working on telehealth. Funding SUD and mental health. Funding SUD and mental health. I told you the very first thing I told you is all about funding. Funding. It is the epidemic within the pandemic. This is what I want you to know. In Georgia, the state budget has to be balanced. That is obviously not true in Congress. It's usually true at your local government. And we're here to say this. We respect at the state level that we have to have a balanced budget, but we're saying that not everything in the budget is balanced. And that's a line you're going to hear us say, not everything in the budget is balanced. So if you've got a disease with people dying and you've got the CDC and Dr. Toomey validating that death after death after death is occurring, our question is, how many deaths are enough before the state gets as serious about this part of COVID as they did the COVID itself? I mean, our disease, substance use disorder, and mental health have been disproportionately impacted by COVID. It was before, but I mean, you can't escape that it has been in the new reality. So how many people have to die? How many people have to be impacted in a serious medical way, even if they don't actually die, before we get Washington to start moving those bills I told you they weren't moving? Before we get the state to say 4 million is not enough, we need to triple that, quadruple that. And maybe we can't do X in the budget in, good times because so our fundamental question is, how many people have to die before we get serious about funding substance use disorder and mental health? And you will hear Neil and I ask that question. We hope you will ask that question. It's a fair question, and it's a question based in science and medicine. So these are some things we'll be talking about doing. These are some waivers and exclusions that can happen. This is all technical stuff. I just want you to know there's things that, again, I told you it's not what we feel. There are facts, there are actual things that they can actually do in law to provide this funding and provide these supports. And we certainly, when we have more time and when we're focused on it in particular, we have done our due diligence. So I want y'all to know that. Decriminalizing. Now look, the Georgia Council does not support legalization of anything, but we do support decriminalization. There is a major moral and legal difference. And we are sick and tired of people going to jail who don't need to be there. And we are ready to plant the flag on the hill and have a fight about it and have a discussion about it. Georgia has one of the highest rates of imprisonment, and we have one of the highest rates of people on parole and probation. It's absurd, absolutely absurd. And you will see us talking a lot about that, and we hope that you join us in that. Help, not handcuffs. I mean, you'll see that line a lot. I put that in there on purpose. We believe that we got to get out of the thing where people go to jail, and that we take some of the fines currently collected. And this is the point I wanted you to hear. A lot of fines are collected. Lord knows I paid thousands and thousands of dollars in fines. And it all goes to law enforcement. And that's, I'm not against law enforcement, more power to them, but we could reimagine, and maybe those fines or some of those fines could go to support our community and programs that help us. And we're going to try to have that conversation with the state and local governments and the federal government that maybe we can reimagine where all this money in the system goes. They're not going to like it, but we're going to have the conversation. Now, there's the last two specifics, and it looks like we got about 6 or 7 minutes, so I think I can bring these two home. These are specifics that we're specifically working on right now. There's a coalition called Beyond the Box. They've got a Facebook page. They're very active on social media. We are part of a coalition. This is not anything we're leading. We're just partners in. But it really, you might call it Ban the Box if you want to know what we're getting at. Beyond the Box is more positive. But this is some, not all, of our colleges and universities still have a box that they use to discriminate against people in recovery or returning citizens, or both, who are trying to, go to college, become a better taxpayer, get a better job to provide for themselves and or their families, and do the right thing. And everybody, should get a chance to get an education, to get that degree, to get that job that pays more money. And I'm telling you, there are people right now that this is impacting their lives. So we've joined this coalition. We're looking to have either a piece of legislation introduced or some rule changes made. It doesn't really matter how it comes to pass, but we will be working with the Beyond the Box coalition to raise the fact that there's discrimination at some of our colleges and universities, and that the university system of Georgia needs a unified policy across the system, that no one has to justify their existence as a human being, and no one has to should be discriminated against when they're trying to get a better education for themselves to provide for their families. And so we're pretty serious about this one. You'll see a lot more about it. We've already had them down at the Capitol. I've taken them around, and we're working hard on this one. So you'll see more about this during the session. And the other one I wanted to mention today, and big congratulations to Jen and John at Reboot Jackson. They are the real leaders on this effort. Long story short, they have gathered the evidence and made the case to the council that there's just a shortage of Narcan in rural Georgia for first responders, specifically for first responders. And I could bore you with the details, but just trust me, that's true. And we've talked with our friends at Georgia Overdose Prevention and DBHDD. We've talked to a number of legislators about this. We don't know, again, what the final answer solution will look like, but having a 5-year-old who picked up a pill laced with fentanyl or whatever in somebody's house overdose or die because when the paramedics show up, they're like, well, we've run out of our Narcan supply in this county. There's just literally none here for first responders. And the kid dies on the floor, whereas if they had Narcan, probably would have lived. what's cool about that? I mean, that's just a tragedy. And so we have got to force a conversation that Georgians should know that when the paramedic truck rolls up, or the fire truck rolls up, or the police car rolls up, or whatever, that in that truck is Narcan. And it does no good to say, well, we had a formula 5 years ago and we're sticking to the same formula, because COVID's exacerbated everything. Numbers are up. So we need more. We need more. And people are trying to say we're doing enough. And we're like, no, you're not doing enough. And we got police and fire and paramedics that will tell you they just don't have it. What part of that's complicated? But it's a fight. It's going to be a fight. And we want you to know we're going to engage in that fight. We want to congratulate Reboot for bringing this to us. So moving forward, this is the last slide I've got, y'all. There's my phone number. That's my cell number. That's my email right there. Look, this is at the state, federal, and local level. Let me explain this to you real quick. There's four, like if you talk about checkers and chess, if you think about it, there's like four versions, right? There's checkers, checkers. Then there's checkers with flying kings, right? Where they can jump all over the board, that version. So that's two. Then there's chess, just regular old chessboard. And then there's three-dimensional chess, where you're playing literally on 3 dimensions at one time, and it's more complicated. Well, I want you to understand that we are playing 3-dimensional chess. Forget checkers. And it's not even regular chess. It's three. So we have multiple things going on at one time: federal, state, local, medical, community, advocacy, training. We've got multiple things that have to happen simultaneously so that we are advancing our community, raising our voice, so that businesses and governments want to fund us and support us, that preachers want to embrace us, that educators want to get us into the school so we save kids' lives, not say that there's no drugs in our schools. Whether Rotary wants to say, come speak to us and educate us more. That's the support we're talking about. We must unite. We must be active. And I'm unapologetic. Social media is free, and you can do it from your TV, from your favorite chair in front of your TV. Please engage on social media if you're not. Please, 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 please. COVID-19, it was the perfect storm for us. It's a bad, bad scene. And we have to embrace that reality and demand more support and funding because of COVID. I would be remiss if I didn't say our executive director, Neil Campbell at the Georgia Council on Substance Abuse. She truly is a national recovery leader. She has a team of 30 plus people. Everybody that works at the council is in recovery. They are very smart people. They care very much. They lead with love. It's a privilege to be on their team, and they're here to serve you in any way, shape, or form. I know that if you're CARES, you know how to reach out to the CARES team, but if you got a question about anything, they'll get you to the right person on our staff. Don't hesitate to ask or engage or volunteer or do whatever. So that's my alarm telling me that I probably am at the point where I have a minute or two to wrap up. So I want to do that. Before I yield the floor to any last questions or comments, I want to say thank you. Whether you had to be here or wanted to be here, it was an honor and a privilege to share with you. I hope you found some of it helpful. I hope that you will advocate with the council and lend your voice and support our community. And the council is very thankful for you, and we love you very much. And with that, if there's any questions, comments, if there's any time, I'll take them.
Allison Broderick asked, I keep hearing SUD referred to as a disease, but I thought we were supposed to refrain from using that word or term.
Oh, no, Allison, with respect, the council, Neil will tell you it's the word we want to use. It's a medical disease. It's cancer's a disease. Alzheimer's is a disease. AIDS is a disease. Scientifically, those are diseases. The battle has been that these are lifestyle choices. These are bad people with bad morals who make bad choices, and those people aren't worth our time. So we're trying to say that, no, this is not about lifestyle choices at all. Jeff Breedlove is not a bad, look, I'm a person worthy of love and to be loved. I'm a good person. I have a very bad disease. Now, I've made some bad choices in my active addiction, and we're not saying people aren't accountable for things they've done or choices they've made. We're not saying that at all. But it was driven by a disease, not that we're bad people. So it's a disease. And if anybody in our community, our broader community says, well, explain that to me, Allison or Jeff or whatever, I would say, what we're trying to say is we're no different than cancer or Alzheimer's or whatever, ALS or whatever disease you're familiar with. We're exactly like that. And just like businesses don't discriminate anymore, you can't discriminate against us. Here's an example, y'all. In 1950, after World War II, well, we're talking about mostly white men. They left the war. They go to these new jobs and these new buildings. Most of them had come from farms. And y'all, I mean, I wasn't alive, but I've talked to my parents about this and grandparents. Indoor plumbing was new to most Americans. Refrigerators, new. Cars, new. Radios, new. People didn't have this stuff, and people wanted this stuff. This was bling. This was shiny new things. Most businesses didn't cover cancer because insurance didn't cover cancer. So men were getting cancer, and they were so sick, the disease was so bad, the stigma was so bad, that they would just keep working at their job knowing they were dying because they wanted to give their family the TV, the car, the house, the whatever. Remember, there's no logic here. There's insanity going on. But they just wanted to give that one more thing. And there's not a business in America today where cancer is treated that way. They've broken that stigma. And we're not there yet. We're not where they were in the 50s, but we're not where the cancer community is today. We're not where the AIDS community is today. They had stigma in the 80s when AIDS came out. I'm old enough. I was in high school when it happened. I know the stigma. And look, today in Congress, there's more federal taxpayer dollars that goes to medical research for AIDS than anything else in America, and Democrats and Republicans fight over it. So we moved from stigma in the 80s to the most federal taxpayer dollars today. And we're not there yet either. We don't get the most taxpayer dollars for our disease. So that was a long-winded answer to say, we want to be a disease, because disease gets, that's my opinion anyway, and the council's position.
And I appreciate it. Thank you, thank you, thank you. Dwayne, what's the job form link above? Amanda, it's the link for the Georgia Recover license application. Everybody, I just put in the chat the information needed if you want to submit your CEUs for this training. We keep a record of who attended this training by viewing the report on Zoom. You put December as the month, politics and policy, the impact on addiction or recovery is the title, and the panelist was Jeff Breedlove. Jeff, thank you for all that you do in the community. And everybody have a great day, have a great weekend, happy holidays, and be safe.
Thanks, everybody. Recovery's real.